I'm going to address the coronavirus testing. Over the last few weeks has evolved tremendously from testing from just 12 centers in the entire United States to now very numerous distribution of test kits, not only by each state, but by public health department, emergency rooms, as well as university medical centers. I think the only place that we don't see right now as a private practitioner is the private doctors. Available right now, of course, is your public health department that you can ask where they can test you. However, it's not all comers. So there are people who are in different counties, like San Mateo County. You can actually have drive-through testing. But all these do require a prescription by your own doctor to say, yes, you need to be tested because you have symptoms compatible with coronavirus infection. Just to summarize quickly the 4 items of symptoms that one should know about if you're at high risk or not in coronavirus. Now, these symptoms will overlap with influenza, like cough, temperature that varies from 100 to 103, 104. You have shortness of breath, and mostly a lot of this chest discomfort, and a lot of secretions in the chest, and that this is hard to cough out. And then in addition, you almost have some gastrointestinal issues like diarrhea. In fact, a lot of people have diarrhea first as presenting symptoms, and the delay in diagnosis can be because of the intestinal issue, which is a lot of times goes unchecked. Anyway, so these are the major ones that influenza can also present. And of course, influenza, if you have these symptoms and you treat it within the first 72 hours, then I think use of antiviral, your doctors can help you with that. Now, testing-wise, it's going to evolve over the next few days to weeks. That is going to be a lot more testing kits available. Labs alone, like LabCorp and Quest, they have their own supplies that doctors can order and give you a prescription to have it done outside. Now, there's a difference between lab results done by emergency rooms and hospitals versus LabCorp and Quest, is that the test return results are usually shorter if you do it in the hospital. So 1 or 2 days versus LabCorp and Quest probably 3 to 4 days. So especially if you do it on a Friday, you're not going to know until Monday or Tuesday at the lab. So something to remind the public that it does vary a great deal. Treatment for coronavirus has developed literally overnight. Since a few days ago, announcement was made by the government as well as through Johns Hopkins and Stanford University. They have gotten responses from other researchers, especially out of southern France, that the infectious disease Dr. Raoult has found tremendous 100% success in curing 40 of his patients with coronavirus infection using medications that are usually for anti-malaria, namely hydroxyquinone as well as chloroquine. It is now being used for coronavirus at a very experimental basis, or what we call compassionate use in the United States. Now, in the US, the Federal Drug Administration have a great deal of control over what doctors can or cannot provide as first-line treatment for coronavirus. As far as we are concerned, to this day, on the 21st of March, it is not available for the general public to use for treatment of coronavirus. Only certain medical centers that it is allowed because they are experimenting with it. The government wants to have, through the NIH, to have actually dedicated projects to actually use it on the first batch of people will be those who are on cruise ships that came on board and are exposed to the virus. They are the first batch of people being studied in the hundreds. So depending on their results, the recommendation will come out later for doctors like myself and to actually provide the option for patients. The second medication that comes to mind is a medication that has been also been used for antiviral, remdesivir, which is a medication that has been used for treatment on viruses. Now, this medication has been also used for coronavirus. Now, the oral medication, which is anti-malarial, is given by mouth, and the duration is also very different. So I think for the public, knowing what the options are is important. There are people being interviewed by the media that said so-and-so was given medication, got cured, and it worked very well. Of course, this positive note is important, and there's actually a lot of studies being done throughout globally in different infectious disease centers. And I think having the knowledge from them, pooling it together and sharing it, our knowledge in treatment will help this pandemic overall.